Hello everyone. Hi. So we are going to have a very good live today on one of the advanced techniques of physiotherapy, which is blood flow restriction training. This live will be by Dr. GD Pratap, who is going to join the live very soon. एंड वी आर गोइंग टू हैव अ ग्रेट इंटरेक्शन विद हिम. ये लाइव सिर्फ पेशेंट्स के लिए या फिर थेरेपिस्ट के लिए नहीं है, ये कॉमन लोगों के लिए भी है. सो ले मैन प्लीज जो भी देख रहे हैं जस्ट होल्ड ऑन बिकॉज दिस लाइव इज गोइंग टू बी वेरी वेरी बेनिफिशियल फॉर यू गाइज एज वेल, स्पेशली फॉर स्पोर्ट्स पीपल. एंड ब्लड फ्लो रिस्ट्रिक्शन ट्रेनिंग के बारे में तो हमें भी बहुत ज़्यादा नहीं पता है, बट yeah, of course, I'm going to learn a lot as well. Sir is going to join us very soon. Hello to everyone who has joined in already. Hello. Hi, sir.
Hi. Am I audible?
Yes, sir. Good evening.
Hello. Hi. Good evening.
First of all, thank you so much for taking out time for this live.
No problem. Thank you. Thanks for the.
And guys, he is my favorite teacher because yeah, he used to teach like very good in the class, and he was great, and now he's a great clinician as well. So without any delay, we are going to start the live now. Sir, can you tell us about what blood flow restriction training or BFRT is?
Blood flow restriction training, otherwise called as blood flow occlusion training, it has the two phase. Two phase in the sense the one phase is all about utilizing this concept in physiotherapy purpose, like to enhance the muscle power and strength. The another area is for the physical competitors. They use us to into the hypertrophy, and also the sports and performance area also can be utilized widely. And blood flow restriction training, if you read the APTA, what it says, it's a scope of physiotherapy practice, because physiotherapists can use these metabolically modified techniques during their training to enhance the muscle strength and hypertrophic response without much load, which is common with the conventional training. My voice is breaking?
A bit, and it is less also, not very much.
Now it's okay?
Yes, it's fine, I guess. People, whoever is watching, you can tell if it is okay now. For me, now it is okay. But there is some network issue because the video is breaking in between as well.
Okay, now it's okay, I think.
So please check if the internet is okay. Yeah, better. Fine. No, again. Guys, yeah, internet problem. Maybe उनका Wi-Fi connected नहीं है, तो we'll just hold on until he returns. Until he connects Wi-Fi. By the way, big hi to everyone. He left, I guess. We will try again. He'll be there in some time. तो तब तक हम रुकते हैं यहाँ पे. Yes, sir. Hi. Can you join in again? Hello, Ajay. Sir, please can you send me the request again so that I can add you in the live, and then we can continue this great session if your network allows. Hi, Sandeep, sir. My voice is okay. Am I audible, guys? Hi, Akshita. I'll just check how. Yeah, I got his request and I'm adding him shortly. Hello. Hi,
Yeah,
sir.
hello. Is it fine now?
Yes, perfect.
Okay, let me tell you what is the blood flow restriction training is all about. If you look at the APTA says it's training which physios can utilize during their rehabilitation process. In
Okay.
rehabilitation, what we concern more is getting the muscle atrophy. Muscle atrophy is one of the biggest issue
Right.
that is prolong our rehabilitation process. So what after ACL surgeries and any fractures, post-operative management give you a lot of concern about the getting the muscle atrophy. In this causes it delays you to go for the yearly weight bearing and walking. So on the other side, you get the elderly population for rehabilitation purpose, where due to the pain, due to the baseline muscle strength, you cannot get the good adequate response from your training. So, on
Yes.
another words, you need a nearly 60 to 80 percentage of one arm to be used to train the muscle. Okay, that is the load is very inconvenient when you use in the rehabilitation, and when you use the patient with the elderly population and all, it's a very unlikely to utilize. So these are the
Yes.
area we uses the blood flow restriction training, because BFRT uses only 20 to 30 percentage of one arm. For an example, you're having the tennis elbow. Tennis elbow likely to give you the pain when you do gripping. So but gripping exercise is mandatory, and it reduces the pain, and it makes you perfect with your grip when you do the active sports. So when you use the blood flow restriction training, you may need not to do the any resisted type of gripping exercise. Just holding the fist, just fisting action is sufficient to cause the great changes. So, and some studies also shows during the training with the BFRT, it alters the pain response. The patient may likely to feel the less pain as they are conventionally getting the pain during the other type of training. So this is what very brief about the blood flow restriction training. And
Okay.
two very important thing comes into play when you uses the BFRT, how it actually works. One is you are reducing the blood flow to the working muscle, so that
Right.
working muscle cannot receive the enough ATPs. When
Okay.
you are not allowing the ATP to store inside the muscle to refuel the muscle during the exercise, so muscle breakdown will be higher. Similar
Right.
things will happen when you uses the heavy weight training. Similar things will happen. So here you are
Okay.
actually producing the things synthetically. You're demanding the muscle to go for failure earlier, with even with the light weights. The second one is,
Okay.
uh, when you occlude the muscle due to the lack of blood flow, lack of energy, muscle increases the production of the lactic acid due to the anaerobic energy demand. It's a byproduct.
Yes.
We likely to enhance the response from the H hands and lactic acid, which reduces the pH value low. Muscle can become the acidic. Acidic environment very important for the muscle to grow. Okay,
All right.
and
So,
another
sir,
one,
there will
yeah,
be some hormone which will be released during this
yeah.
acidic environment.
Yeah, we get the growth hormone, insulin growth factors. Recently, even testosterone response towards the training also is good. These are the vital hormones which can gives the anabolic response to the muscles.
Right, sir. So, somebody is asking, do you measure 1 RM or approximate value is fine?
You can measure the one arm. If in most of the condition you cannot actually measure the one arm, because the patient you get is already injured. You cannot actually measure the one arm. We usually have a different perspective in physiotherapy. We likely to go with the safe light weights. We can usually choose the light weights. That's not a tough task.
Right. Sir, for the layman who are watching this video, what actually is done in BFRT? What is the procedure? Like basic.
Your therapist will go for the BFRT using the cuffs, pneumatic cuffs, which is if it is available. Otherwise, the simple strap does. A comfortable pressure he will be putting up on your muscle belly. Especially, there are two places you can actually reduces the blood flow. One is the just between the deltoid and biceps belly. The next one just below to the, your gluteal folds. These are the two areas you can usually apply the blood flow restriction. So during
Okay.
the exercise, your therapist chooses the volume. Volume usually 75 reps. In the sense, first set will be 30, the next set will be the 15, 15, 15. So you'll be having the three sets of 15, one big sets, which is likely to be done before the second sets, would be 30 reps. So 75
Okay.
volume when you do, you should not feel the compression is too tight that occluding your nerve flow or any severe pain or any numbness you should avoid. So comfortable
Okay.
one pressure likely to enhance the vascular occlusion. You may feel little pump kind of feel like you when you uses the normal muscle training, you feel the you get the blood flow occlusion that causes you pump. This kind of response you get, like you may also get the little burning sensation that building up inside your muscle. That is the one which
Okay.
you likely to get, and which is very healthy.
That is normal. Even if we get the burning sensation, that is normal.
A burning sensation due to the failure muscle failure is normal, but if you get the
Okay.
burning sensation during the first reps also, like doing due to the extra pressure, that is
Right.
abnormal response. Yeah.
Okay. So, Physio Neha is asking, what are the contraindications in
there are there,
BFRT?
there there are a lot of contraindication and cautions. Any vascular
Yes.
deficiency we are not going to do, and any
Mhm.
uncooperative patients, if any patient with the cardiovascular issues, unstable hypertension and angina pectoris, recent history of mi, and and diabetic, severe diabetic neuropathy, wherever the
Okay.
exercise itself contraindicated, absolutely you're not going to use. And in some conditions who naturally having the thick blood, likely to get the clots formation, then we are not going to do.
Okay, so those people who are already on aspirin, we know that yes, their blood, there is a tendency of thickening of blood. In those patients, we'll avoid, right?
Yeah, see, if someone already having the some myocardial infarctions or CAD, coronary artery disease, and they're having the poor autonomic nervous system, then we are not supposed to use. But some, nowadays, even for to prevent the for future cardiac issues also, even yearly hypertension also, people utilizing the aspirin and other anti-hypertensive tablet. In such cases it's okay to use, but all you need to know is how to select the AOP, atrial occlusion pressure, and you may need to go for the some kind of test. We have 1 minute cardiac recovery test to test the vagus nerve parasympathetic system inputs during the training. So this all likely to learn inside the course. I cannot elaborate completely. We have the
Yes,
strict criteria to fix the patient inside our program. So unless if you know very well, you cannot apply.
right. So, good training is important to apply.
Yeah. Definitely, when you
So
when
we
it comes
should,
to the patient with the little bit of complication and cautions, of course, we need to go really careful evaluation before we apply BFR.
yes, if you are just a physiotherapist who has never used BFRT or never been trained in that, I would not suggest them to use it on patients. What do you
Yeah.
say, sir?
See, if it is a sports population, just even looking at the YouTube people started using it, that's a different concept. But if when you use it in the elderly population, people do have the hypertension and other diabetic cases. Definitely, you need to know the science and the entire protocols to be applied. Without that formal training, it's better to avoid.
Yes, sir. Sir, so what is the physiological response? I mean, when we use it, what actually is happening?
You likely to reduces the blood flow to the maximum 60 to 70 percentage of atrial blood flow. That is equal
Okay,
to more than 90 percentage of venous outflow. For an example, if you put up the pressure, we will be selecting the 50 percentage, 60 percentage, 70 percent. It depends upon the condition, and that equals to the more of venous occlusion rather atrial occlusion. Okay, so
okay.
yeah,
So,
you can easily occlude the venous flow rather the atrial flow. If you put up one particular pressure, that actually is so hard on the venous system than the atrial flow, because heart actually pumps out of the atrial flow. You getting it? If you put up the pressure, your
Yes.
heart is very small. It can pump even with out of the pressure. So that pressure actually affect the more of the venous system than the atrial system. So that is somewhere around 90 plus percentage of the venous outflow you're gonna reduce. So when you do this, you actually gonna store the metabolic waste inside the muscle during the training. Okay, so
Okay.
this metabolic
Yes.
waste will not go out from the muscle. So like for an example, lactic acid, you have the H ions. This all stored inside the muscle during the training. Second, you are not allowing the ATP to pass and refuel the muscle. So muscle without enough ATP, what it happen,
Yes.
it creates the
Lactic.
metabolic demand. Okay,
Yes.
your white fibers, which is actually gives the strength and hypertrophy, likely to get damaged without enough ATP during the training.
Okay.
So if the white fiber damages more, your net growth of the white fibers will be more. That is what
Mm.
the our target also. And the another thing, due to the venous occlusion, the pressure inside the muscles and the tendonous junction is higher. So your brain recognizes there is a huge demand. You are putting up the more of load in your distal component. It assumes. So cortical firing rate towards the white fibers will be higher. So the white fiber recruitment also higher during the training. But this is unlikely to happen in a normal scenario. Why? Because normally what when you use the low intensity of exercise like without weight cuff, you just asking them to do isometrics or knee extension, your red fiber will fire more because there is no heavy load in the leg. So red fiber is responsible for the low intensity of aerobic activity. But
Yes.
when you use the BFRT with the same load, even without load, brain assume due to the venous pressure, it assumes that there is a load. So it increases the firing rates of the white fiber. So if you fire the white fiber, you're actually training the white fiber. Definitely net growth of
High
the,
intensity.
yeah, you will be getting the same response as the high intensity exercise. The
Correct.
additionally, uh, this vascular occlusion causes endothelial growth factors to stimulate it. This endothelial growth
Okay.
factor is responsible for two things. One is it increases the secretion of nitric
Group.
oxide. Nitric
Mm.
oxide dilates the vessels to promote the blood flow. It improves the nutrition to the injured tissue. The second one, uh, due to the friction pressure over the vessels, it releases the endothelial growth factor. It is responsible for your vessel to go for widening. You can see some gym population, they do have the very very good healthy vascular opening, bulging of the veins and arteries. That is a
Oh,
healthy response. You will get the better blood flow. Second, vasa nervosa, you may likely to increases the new blood vessel formation into the local tissue. Your muscle
okay.
get the better VO2 max by improving the tissue perfusion ratio get improved because of lack of greater flow to the blood flow through the newly formed vessels. So BFRT actually not
Great.
only can enhance the muscle strength, it also improve the muscle blood flow and endurance also. VO2 max also likely to go get better.
Wow, great. How magical it is. Like
Yeah.
you are increasing the demand and the brain is acting accordingly. It is
Yes. Yes.
increasing the white fibers. How
Yeah.
magical. And I'm really amazed to know this. Even I didn't know much about it. Thank you so
Thank
much,
you.
sir, for telling us. And sir, I just one question struck my mind just now. Does it have any role in neural plasticity as well?
Neural plasticity, there is no direct role. Of course, neural plasticity likely to happen when you do the repeated
Task.
task oriented. It's more of task oriented. But
Correct.
someone having the weakness, they are unable to perform the task really well due to the muscular, muscular strength, lack of muscle strength. For an example, you are teaching them reaching activity. Triceps are not so good. Excuse me. I'm sorry. Okay.
It's okay, sir. Mm.
So selective muscles training, for an example, someone is not out of the synergy. Synergic dominance will be there after the stroke. But some particular patient, they do not have the synergic pattern, but only they have the weak movement. For them, it is good
Yes.
to use the BFRT to gain the muscle strength, and you can utilize in your functional activity. You getting it?
So you
But
have
yeah,
used it in your stroke patients?
no, not it. I'm not getting the right population, so I cannot use someone having the spasticity. It's unlikely
Hmm.
to use because spasticity itself occlude the blood flow. So we
Yes.
have greater issue in the measuring the AOP, so we cannot use. But otherwise, if the patient is showing the isolated movements are possible and they are just muscle power 3 or 4, you likely to, for an example, shoulder is fine, but the elbow extension is lack, then I'll be using for the uh, triceps. The beauty of blood flow restriction training is sometimes you can utilize even with the neuromuscular electrical stimulation without any movements in the joint. Just apply the
Okay.
pressure, apply the neuromuscular electrical stimulation. Definitely worth to enhance the muscle power.
Okay. Wow. Great. Sir, if you allow, we'll go into the questions.
Yeah, please.
One question is there in the question box. I'll address that first. Akshita is asking, like it works on the mechanism, muscle or tissue injury. So how do we use in patients? Is it painful? Is it painful?
No, it's completely painless. Uh, it depends upon the population, how much pressure you are using. But it's with the BFRT, you're gonna do the very very light exercise. It's
Yes,
more lighter. For an example, someone who is walking capable enough to walk, you're going to use the 500 gram of weights in your quadriceps and you're using. This 500 gram unlikely to cause the pain or do something to the joints. So
correct.
hence it's very, very effective for the ONE population who needs muscle strength in the quadriceps and they cannot load the huge weight. Someone having the tendon injuries, you cannot load the tendon with the huge weight in early rehabilitation. So you have no
Correct.
other option left. You'll be going with the blood flow restriction training using the light weights. BFRT uses light aerobic exercise, light resisted exercise, not the medium or high intensity.
Great. So yeah, obviously it is not painful, but during the application it might be a bit painful, which is okay.
No, not at all. You are not supposed
No,
to
it
cause.
is not.
No, it is not.
Not even during the application.
No, no, definitely.
Oh,
If it is painful, then definitely pain comes
then
from
it is
the
contraindicated.
why the pain comes. Pain can be due to the any nerve issues or any vascular
Yes.
issue or pre-existing infections or inflammation. So you're supposed not to do.
Okay, okay, fine, sir. So there was one more question related to the same. She was asking in which condition this works the best.
Every musculoskeletal condition you have a role to play. So how many physiotherapy techniques are having the level on evidence in practice? Anybody can challenge me. How many physiotherapy techniques do have the level on evidence in the physiotherapy apart from the exercise? There is nothing. There is nothing actually. Okay, if you choose the Maitland, if you choose the Mulligan, you choose any manual therapy, it has the moderate evidence and it is a patient oriented evidence. You cannot generalize the application, but when it comes
Yes,
to the exercise, especially with the blood flow restriction, and it has the level 1 meta-analysis reports we are getting for the improving the fitness of the patients and to accelerate the rehabilitation process. But we are unlucky that we are still not accept to learn the BFRD soon as possible, and we are running towards the cupping therapy. That's really bad
yes,
to see, and people are so proud. I always say, like, if you do cupping and you believe that actually helps your patient, then you just throw your physiology.
exactly.
It's,
We are movement therapists. I always say we
yeah,
are movement therapists, so we should work on that.
you can use whatever thing your patient want, because in evidence based practice there is one line like patient values, like what patient actually believes to heal them. But what makes the patient believe, because you are putting up the reels everything using the BFR, this cupping and other coactory treatments in
Yeah,
your, that's how it actually you are creating that kind of environment to make the patient to believe. So it's responsibility of all the mature physios to handle the situation with the sense. So BFRT having the level 1 evidence in the musculoskeletal practice, and it actually,
Level 1.
uh, yeah, it's going to be in the textbook soon. ACTA page do have all the updations with the BFRT. So, and the moderate evidence we are getting in systemic disorders like blood pressure, hypertension, and diabetic neuropathy. These are the areas also getting the strength towards the results are getting better. So we need more research to come out. Then we can talk
Yes,
with more.
definitely. Exactly. So, I would like to tell people they can ask the question in the question box or in the comments. They can put the question. We'll take up, sir will take up those questions. Meanwhile, I have few more questions to ask,
Yeah.
which were already asked by people. It is, are the effects of BFRT temporary or permanent?
See, nothing is permanent when you do strength training or using the BFRT or conventional strength training. Nothing is actually permanent. Why? Because it is use it or lose it. Okay, until you use, you will be having this sustainability. That's what we study
Okay.
in progressive resisted exercise. A reversibility
Yes.
principle says what? Until you use, you'll be having the good response. When it comes to the BFRT, uh, it is to help you to get into the another track where you cannot perform the conventional training due to your illness. So now you are gained muscle strength. Now you are okay to perform the strength training. So there you won't use the BFRT more. In a first phase, second
Okay.
phase, you'll be using the BFRT more. When you back to the game, back to the sport, you are not going to use the BFRT much. But some actually uses to enhance the uh, during the functional training or conditioning, they will enhance the training response. In particular area you'll be using, but not like you are using in acute phase. On another hand, if you see, another hand, elderly population, they do have the muscle wasting. There is no way they can actually do the conventional training. For them, they need easy exercise using the BFRT, so they can use until they want the good changes. They can actually BFRT gonna increase their muscle strength, which can reduce their disability and chances to fall, and it's extra tough. Also, the recent evidence says it can improve their bone mass also. So if you have the better bone mass, better strength in your lower limb and upper limb, definitely you will be having the good aging.
Correct. Sir, I'm so sorry. In between, your voice is breaking a bit.
Okay,
If you can
okay.
just check once.
I think everything is here fine. Maybe.
Okay. I will also check. Whoever is watching, guys, can you please tell if the voice is fine, everything is fine? We'll just hold on for 2 minutes, if you permit, sir.
Yeah, please.
Mm, okay, we'll just progress the live now. I'll ask another
Yes.
question now.
Yeah, yeah, please.
So, next one is, do timings and repetitions matter in BFRT?
Yes, strictly matters, because we do have with the 75 volumes in a session. 75 is the volume. We'll be splitting into the 30, 15, 15, 15. So if it is the
Okay,
strength training, you have to complete within 10 minutes BFRT
right.
session. So if your training is going beyond the 10 minutes, then you are going to give the reperfusion time. Like after every 10 minutes, you're gonna give the blood to passes through the restriction for 5 minutes. That's called reperfusion time. 3 to 5 minutes we'll be giving. After that, we'll be
Okay.
having the second innings.
So, sir, how much is the resting time in between?
From every sets do have the 30 second to 1 minute resting time.
Okay, correct. So, next question is it important to buy a proper cuff for BFRT or conventional bands are okay?
Conventional bands are okay, of course, because here is everything about the uh, patient specific occlusion pressure rather than the research oriented. Even every
Okay.
researchers are arguing that you cannot go with the numbers. Numbers are good for the researchers. Here you need to value the patient. If the patient is feeling the pressure is okay, and it occluding their blood flow enough, and they are not getting the any kind of numbness or any other discomfort due to the pain, that is the pressure you need to put up. So
Maintain.
straps does the same thing like a pneumatic cuff. Pneumatic cuff and other devices, even electronic devices, are available, which is very sophisticated. These are okay in when you handle these very sensitive patients, like very hyperacute patients, and patient with the some kind of vascular issues, or patient with the cautious. These are the area you need to use the really good uh, instrumentations. Otherwise, the strap does the same thing like your immunity cuff.
Right. So in relative contraindications, we need to be careful
Yeah, yeah.
and use
We
the
need.
pneumatic cuff.
Yeah.
What are conventional bands? I'm just eager. What to use in conventional bands? What things
You
can
can
we use?
you can use the straps, nylon synthetic straps, which is little flexible, and which is not like a kind of thread. It has the width. We have the width, special width for the restriction of blood flow. It's supposed to be
Okay,
5 centimeter minimum for upper limb. It should be
right.
8 to 12 centimeter for the lower limb. And you can get through the Amazon. In Amazon we have so many bands, blood flow restriction bands are available that you can utilize.
Right. Okay, sir. So, we can't use normal cloths and all we have. We can't tie with knots and all. That
No,
is
no,
not
because
advised.
yeah, it's also discomfort. When you do the training, you likely to enhance the venous occlusion, that your muscle get bulging. So you need a something that actually stretches when muscles are becoming acute hypertrophy response. It should not affect the muscle flow, muscle contraction flow. It should not affect. So in that case, nylon material which is stretchable can be preferred.
Okay, sir,
So
if you
which you
can
can
please
get in
share the
Amazon.
link. Yeah.
Yeah, yeah,
If
I'm
you can share
sharing.
the photos and links, I'll share with my audience as well so that they can check so that they buy the authentic one.
Ask them to attend the course rather practicing
Yes,
straight away.
correct. It is required. I also want to attend so badly.
You're
So,
most welcome.
yes. Now we'll go to the next question, which is, can you explain how BFRT can be helpful in ONE?
In ONE, joint get damaged. Most of the OA population are obese. When you are actually obese, your muscle percentage is very, very less than the fat percentage in your body. The extra amount of the fat with these tiny muscles are incapable enough to bear, and the stress is going inside the joint, and you're getting the increased aging of your joint cartilage. So, due to the pain, you cannot bear the weight. Due to the pain, you cannot actually
Yeah.
do the training enough. So, our target is to enhance the muscle strength in the joints, especially in the knee. Your quadriceps is the one of the very important muscle to gain with the ONE. So you'll be going for the strength training using the OKC, open kinematic chain exercises. But here,
Yes.
when
Okay.
you use the 200 gram or 500 gram or even 1 kg, if you use this, initially you may get the hypertrophy response due to that load is sufficient, but later on you cannot get the enough hypertrophy response. In such cases, using the BFRT can actually give them a good muscle hypertrophy response. If you get the good muscle strength, definitely your joint loading pressure can go below par, which
Yes.
is very, very important to get.
So it is the most important practical implication as we all see a lot of ONE patients. So
Yes.
yeah, we can
Even
use it.
even for a pre-rega purpose, you get the 6 to 4 weeks before the surgery to prepare the patient to undergo TKR. After that, after the surgery, every patient gonna get the atrophy. It's
Yes.
study shows 20 percentage of atrophy people they cannot gain their, sorry, 80% of atrophy from the vastus lateralis and medialis is not gonna come out. It is not going to come back. So in such a cases,
Oh,
you have to select the patient, and you need to go for the undergo the pre-recap program 4 to 6 weeks before they go for the surgery. If you gain the
Correct.
maximum muscles before the surgery, you likely to get the better, very, very better rehabilitation
Results.
outcome after the surgery.
Okay. Wow, great. The repetitions before the surgery and after the surgery, it differs?
No, reputations is, we have the these questions addressed by the research, but still, you need to achieve the failure. For an example, some patient even 200 gram of weight is unable to complete the 75 reps. For them, we will not use even the resistance, just to mobility exercise using the blood flow restriction curve, and ask them to go
Okay.
for the maximum muscle contractions within a particular limit.
Got it.
We're gonna make the muscle tired. We don't calculate the reps there. Reps is like minimum value patient should achieve, calculating the particular weight.
Okay. Okay, sir. Got
If
it.
someone is not even getting the fatigue by 75 volume, there is not much of a response, fatigue feeling, then you are not occluding your blood flow is enough, or you're not choosing the right
Weight. Weight cup.
right. That's the meaning. So you'll be likely,
Okay.
either you'll be adjusting the blood flow, or you're gonna adjust the resistance which you are offering.
Correct. Correct. Got it. Very clear, sir. Thank you.
Thank you.
Now, another question is by restricting patients' blood flow, is there any implication that can occur? If yes, how to check if it's causing a problem?
So if you are, for an example, like you applied the kind of pressure, and you ask the patient to do every 1 sets after, it's okay to check the patient's status, because due to the vascular occlusion itself causes the secondary pressure inside the muscle. So you probably you started with the 50% of atrial occlusion. Now it is automatically went up to the 70% atrial occlusion. So in such a cases, when the occlusion pressure is so high, patient may get the increased heart rate, they may get sweats, and they may get the severe discomfort, palpitation, or anything. It's definitely to withdraw the blood flow restriction training. But this is unlikely to happen when you are actually have the good sense of ideas from the course. Like formal training is much important in these areas, and if your patient is feeling the numbness or any kind of distally they feel the numbness or dysesthesia, any sensory impairment, you're supposed to
Okay.
remove the cuff.
Okay. Even if some radiating pain is there, then also you are supposed to
Yeah,
remove the cuff.
yeah, yeah.
Okay. Sir, the pressure, does it depend on age as well, or just the individual rate of
Individual.
perceive, just the perception of the patient, not the age?
Perception of the patient, like we even uses the Doppler. Okay, we uses the handheld Dopplers to check the blood flow distal to the occlusion, and by that we will be calculating the AOP in sensitive cases like diabetic people and all. We will be even calculating the ABI, break angle brachial index, before we
Hmm.
admitting the patient. If the angle brachial index are so bad, then patient might be having the vascular deficiency. In such cases, it's better to avoid. Even if you have the risk versus benefit, if you're assessing and you're still going with the BFRT, then you'll be using the very least pressure, 50% or less than 50% of atrial occlusion pressure. So
Correct.
this all the patient sensitive, like you need to go according to the patient. For example, even if you see you have the small muscles than me, so I'll be using the little more pressure than the pressure on you. Okay,
Oh,
because
yes.
your arm size is smaller, and you already not into
Yeah.
the training. First time you are into the training, your body responds indifferently towards the training. For me, it's already I given the enough information to the body. Anytime it is always ready to undergo the training. So this differs patient to patient, age to age. So elderly population, they do not have the very good cardiovascular system. So in
Correct.
such patients, it's always okay to go lesser the pressure for a few weeks to judge their capacity to recover from the exercise. Then you can go for the augmented pressure, which is necessary.
Yeah, then you can progress accordingly.
Progress. Yes, yes, you can progress.
Yes, so the next question is there any outcome measure related to BFRT?
Acute outcome measures will be using the just inch tape. How much vascular occlusion you happen that bulges your muscle, how much pump you getting, and chronically we'll be assessing their pain and disability status and their weight bearing capacity, their range of motion, then their muscle strength, everything. Whatever physiotherapy actually going to help you to improve the status of the patient, you can do with the BFRT as well.
Correct. So there is no specific outcome measure for the same, specifically
No,
tailor-made
no,
for BFRT.
no,
No.
no, no.
Okay. Next one is best result of BFRT is obtained in which group of patients? This already you have answered, I guess.
Musculoskeletal. Anyone with the
And
musculoskeletal issues, or if you are a gym going population, definitely you can use every week, twice or thrice, or for particular muscles to enhance the growth of the muscle.
correct. So next and last question which I have is the person is saying I've heard about BFRT increasing intracranial pressure. How? And is it safe in osteoporosis? Like two different
It is
questions are there.
It is actually
Is
safe in osteoporosis. It's definitely safe in osteoporosis. Intracranial pressure actually should reduces, not increases. Why? Because you are, see, for an example, if you occlude the blood flow, the limb blood flow, if you're occluding, definitely
yeah,
less blood flow will go to the inside the brain. It's not the higher. Okay, and also brain never compromise its own blood flow. It never compromise. So 18% blood flow is continuously get into the brain often, so unlikely to increase the ICP.
okay. So this one is increasing the venous return more, I guess. It
No, no,
is it
it,
increasing the venous return?
no. It is not going to increase the venous return. When you occlude, you're reducing the blood getting into the heart. So heart recognize that the less blood is coming towards me. Okay, so
Okay,
heart rate will be increased initially. Okay,
correct.
so to maintain the cardiac output, actually heart rate is increasing. That's the Frank Stirling law. Okay, so when you remove the cuff, now the autonomic nervous system plays a role to reduces the heart rate, to reduces the your blood pressure. So we
Yeah,
check these
parasympathetic.
changes. If you are actually increasing the heart rate, and after the training heart rate is coming down quicker, that means you are the right individual for the undergo BFRT. If you have issue in bringing the heart rate down quicker, or your blood pressure comes down quicker, not coming down quicker, then you're not a right person to go for training and BFRT.
Okay, got it. So it is important to check the blood pressure and heart rate, all the vitals before and after BFRT.
Yeah, we definitely will check. We check the before and after the training for the patients, not for the you and me. Fitness area, no
Okay,
need to worry. Only for the patients with the elderly populations, the mild hypertension cases, pre-diabetic population, obese patients. These all the patients will be doing this.
okay, got it. And I really think that I need to attend your workshop to know more and more about this because, yeah, even I mean, 45 minutes to 1 hour, this is not enough to gain full knowledge about something
Yeah,
new as
definitely.
BFRT.
Yes.
Yeah. So I will just check the question box once. No questions, but appreciation comment, Dr. JD. It is always an insightful moment to listen to you. Jordan is saying he was our
Thank you, Jordan.
classmate.
Yeah, Jordan is in Europe, I think now. He's in Europe,
Yeah.
Germany.
Okay. Yeah, I keep seeing his posts, but I was not sure.
Thank you, Jordan. Jordan was
Yes.
my first student in Lovely. First student in Lovely.
Oh, first student.
Yeah, first student. First means the student I met first for teaching, for
Okay. Wow.
physiology.
And then you started teaching us neuro, which was very interesting class. Nobody used to sleep in that class. Very good class, active
I
class.
tortured people whom so sleeping. I was
Sorry?
torturing, right? I was
No,
torturing.
no,
They sleep.
not at all. Yours was one of the most productive classes. I can say this in front of anyone. It was one of the most productive classes in LPU.
Thank
After
you. Thank
Dr. Gayatri. Dr. Gayatri and you both, you remember Dr. Gayatri?
Yes, yes, yes. I do. I do.
Yeah.
She's in Canada.
So,
Yeah,
yeah. So I guess we'll wait for another 2 minutes, then we'll wrap up. If anybody has any
definitely.
question, they can just send it.
Sure, 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 Sylvie.
Yes. Guys, you can ask your questions. Another 2 minutes left, and you must enroll in his workshop. When is the next workshop, by the way?
It is in Mughali. Actually, it's a hybrid
Mohali.
workshop. Yeah,
Okay.
we had the blood flow resistant training, as well as Dr. Mani Taroda is taking up course for the ACL reconstruction surgery in a
Okay.
physiotherapy aspect. What physiotherapists actually
Oh,
need to know when they treat the ACL injuries, and he's going to teach the how actually surgeries are performed to improve the patient outcome. And another radiologist going to teach how to read the ACL injuries in MRI. Then
great.
another one, Dr. Physio, she's teaching going to teach what actually acute rehabilitation looks like. In my portion, I'm gonna teach the conventional blood flow restriction training, and how blood flow restriction training actually you can use during the ACL rehabilitation. And it's a full course also we'll be offering on particular day. So
Okay, so
that
it's
is going
more
to
of
be.
a condition specific workshop.
No, we have the general module, and we'll be highlighting the ACL rehabilitation in particular workshop.
Okay, so how many days?
It's a one day course.
1 day,
Yeah,
9 to 5.
it is 1 to 7. I hope
Okay, when is it?
it is in Friday. I hope it is in 10th June.
Oh,
10th.
so soon it is. We can't
Yeah.
grab it now because,
So,
yeah,
yeah.
obviously. Anybody who wants to attend his workshop, they can just DM me or sir directly. He will guide you. Maybe some seats are left or already filled.
I'm not sure, but I think left 5 6 seats supposed to left.
Okay. So anybody who is in Mohali, they should not miss this chance. Traveling issue is
Anybody
not
who's
there.
in Punjab, they should not miss.
Yeah, I am in Himachal.
Oh, for Himachali people, Punjab is it's like they can come and go in a day.
Yeah. We'll arrange one in Himachal as well in the coming time.
Sure, sure, sure.
So, I guess there is no more question. Can you just tell the nutshell of BFRT once, sir? Anything which we should be careful of, or just the summary of the talk?
Okay, blood flow restriction training, one of the very essential thing in physiotherapy practice, because it actually game changer in many cases. I keep sharing the things like case reports and all. So if you see, definitely one week before I was not having the better muscle strength. Now within a week I can see the good growth in your. If you follow me, you would have seen that my weight
Yeah,
I'm lifting, everything is changed, and I have a very good hypertrophy response. So this is what blood flow restriction training does. Short term with the less resistance, you'll be getting the good response from your training. So that can be utilized really well in rehabilitation in a variety of patients. One patient with the hip arthritis we started using, and he is now walking better. So this is game changer, that you cannot get from the conventional training. So if you see in USA, every clinicians they are applying BFRT in their musculoskeletal practice. It's become very essential thing to have. It's like your TheraBand, it's like your TheraTube, it's like your weight cuff, which is supposed to be in your clinical setup. And like when you can actually do something for helping your patient, there's nothing wrong
yeah,
in learning. Okay, and also you need, some people they ask, where did you buy the cuff? Let me buy. No, these things don't work this way. Buying the knife cannot make you surgeon. You need to undergo
yeah,
training. Okay, so
correct, correct.
definitely I encourage you people to start getting the formal training. We offer the certification course level 1, level 2. Level 1 for the clinical application, level 2 is for the sports and fitness. People whom are completing the level 1, level 2 will be offering the certification, certified blood flow restriction training provider. Okay,
Correct.
so
Okay.
this would give you the international credits and also improve your practical skills during the
Yeah,
I
so
mean during the clinicals.
just as sir is saying, in US everybody is applying it, so I guess sir's mission should be in India also. In every clinic there should be the application of the same, rather than another techniques like cupping and all. This should be in every clinic as well.
Definitely, it should. It's supposed to.
Yeah, so it should be your mission, sir. Just move on in this mission. All the best.
Yeah, one final word. As we are growing, okay, we are going into the science. We have the well quality of evidence in the physiotherapy concepts. So every study shows like exercise likely to give the better rehabilitation outcome. So if you choose to learn the exercise as the primary treatment options, blood flow restriction training is one of the best thing to have. Okay, so when there is no competition with any other treatment when you practice the BFRT. I'm sure about
Mm.
that. Even you don't apply the muscle stimulator, you apply the muscle stimulator, but BFRT does the beautiful job to improve the your functional outcomes. All you need is formal training. I hope everyone will likely to get that. So
Yes, I hope that a lot of people have learned a lot about BFRT, but this is not enough. Don't apply it without proper training.
yeah,
This is the message, take home message. And also, sir, I would request you to take another live in some days or whenever you are free on neuro rehab as well, because that is your expertise, and we want you to talk about that as well.
sure, we likely to get that.
Thank you so much, sir.
Thank you, Surbi. Keep doing the great works.
Okay.
Good time. Good luck.
Thank you, sir. Thank you so much. Okay, bye. Bye, everyone. Take care. Bye bye.